Welcome everyone to the Santa Barbara County Food Action Network Community Food and Farming Discussion Series. Lena is our interpreter for today, and she will go over how to access Spanish interpretation.
Hello, this is a bilingual message and will be repeated in English. Buenas tardes, buenos días. Mi nombre es Lena Morana Cereto, soy de la compañía Uniendo Voces y yo soy la intérprete para el evento de hoy día. Proporcionaré interpretación simultánea entre el inglés y en español. Un entorno bilingüe virtual exitoso depende de todos nosotros, no solo de la intérprete. Pueden ayudar teniendo en cuenta algunas cosas. Hablen claramente, por favor, para asegurarnos de que se les puede escuchar. Hablen a un ritmo moderado, por favor. Tengan cuidado de no hablar muy rápido, especialmente si están leyendo, para que podamos mantener el ritmo. No queremos que nadie se pierda de nada. Solo una persona debe hablar a la vez, así no tengo que elegir a quién interpretar. En un momento, la anfitriona activará la función de interpretación y en la parte inferior derecha de su pantalla podrá seleccionar el idioma en el que desea escuchar esta presentación, en inglés o español. Si nos acompaña por un teléfono o una tableta, entonces encontrará el menú de 3 puntos y seleccionará Interpretación de idiomas y su idioma. Si tienen algún problema con la función de interpretación, envíen un mensaje, por favor, al anfitrión a través del chat. Gracias. Hello, everybody. My name is Lena Morana Cereto. I'm with Bridging Voices Interpretation. I'll be the interpreter for today's event, and I'm providing simultaneous interpretation between English and Spanish. A successful virtual bilingual environment depends on all of us, not just the interpreter, so you can help by keeping a few things in mind. One is to please speak clearly to ensure that we can hear you. Speak at a moderate pace, and please be careful not to speak too fast, especially if you're reading, so I can keep up. We don't want anybody to miss anything. Only one person should speak at a time. That way I don't have to choose whose voice to interpret. For our bilingual participants, please feel free to speak English or Spanish as you feel most comfortable. Just don't change the language in the middle of the sentence. In a moment, the host will turn on the interpretation feature. At the bottom right part of your screen, you will be able to select the language you want to hear the presentation in, English or Spanish. If you're joining us on a phone or a tablet, then what you'll do is find the 3-dot menu, click on that, select language interpretation, and find your language. If you're having any trouble with that interpretation feature, send a message to the host through the chat so the issue can be resolved. And I will now ask our host to please make me interpreter.
Thank you, Lena. So this webinar is being recorded. You will receive a link to the recording and other resources after the event. All resources will also be made available at www.sbcfoodaction.org/CFF. This is an active session and your engagement is welcome. We invite you to ask questions in the Q&A during presentation, and the panel will answer them as we are able to during the presentation and in the Q&A time at the end. You may upvote or comment on questions that other people have posted. Questions we're not able to respond to during the event will be answered in a top 10 list included in the resources you receive later. We apologize in advance if we're not able to respond to every question. Please use the chat for any other comments you may have or resources you want to share. Remember, you're the network. We support a team here to help us. Sorry, we have a support team here to help us, including Iris, who you'll see as one of the panelists, Alan and Kayla. Okay, let's get started. The purpose of the Santa Barbara County Food Action Network is to connect, align, and activate a network of food system actors to develop a robust local food economy, a healthy and just community, and a well-stewarded, resilient food shed in Santa Barbara County. We're a new network formed in the fall of 2019, and we were brought together to scale up and diversify the implementation of the Santa Barbara County Food Action Plan. The plan, published in 2016, details 16 specific goals aimed at improving the resilience and sustainability of our local food system. We recently released a request for proposals for food system projects. If you haven't seen it yet, it will be linked in the chat. And we will be granting to awarded projects at the end of this year. We are also launching a public membership auction in the next month or so. So to learn more about these efforts, please visit our website, which is linked in the chat. This is the first of 3 webinars in October through December on community food and farming. So please check them out and sign up. The focus of this discussion is obviously on food access and food security. How are we and how can we better and equitably meet the basic food needs of our entire community? Today, we really want to highlight current efforts to support and care for our community's vulnerable populations by ensuring access to nutritious and affordable food and opportunities to scale and deepen these efforts. So, I'm pleased to welcome all of you and all of the panelists who are our local experts in food access and food security issues. We'll have the panelists introduce themselves, and then we'll dive into discussion and then make some time for Q&A at the end. So now I'll start with Maria Gardner. Take it away, Maria.
Good afternoon. My name is Maria Gardner, and I'm the Deputy Director over the Economic Assistance and Employment Services branch of the Department of Social Services here in Santa Barbara County. The mission of our department is to help our community be safe, supported, and self-sufficient, and I'm happy to be here today to discuss food security and the Calfresh program in particular.
Now, Shelby Wild, let's hear from you.
Hi everyone, thanks for having me. I am Shelby Wild. I'm the Executive Director of Route 1 Farmers Market in Lompoc. We are a farmers market that's working specifically towards increasing food access and access for sales in Lompoc Valley.
Next, let's hear from Daisy.
Hi everyone, my name is Daisy Basulto and I'm the Calfresh Outreach Coordinator for the Foodbank of Santa Barbara County. And our mission is to end hunger and transform the health of Santa Barbara County through good nutrition.
Fantastic. Melissa.
Hello everyone, I'm Melissa Fontaine, Food Security Coordinator at UC Santa Barbara, and I'm an advisor to the Calfresh team and also to the communications team for food security and basic needs.
Fantastic. And last but not least, Casey Connealy.
Hi, my name is Casey Connealy. I'm a research assistant working for the Sansum Diabetes Research Institute, working directly with the Mil Familias program and the Farming for Life program. Here to promote our vision that food is medicine. So thank you for having me.
Thank you all again for being here. I am fired up to have this discussion, let me tell you. But first, we wanted to poll the audience and ask what you think the rate of food insecurity is in our county, just to set a baseline for this discussion. So as you'll see the food insecurity poll on your screens, please answer, what is the Santa Barbara County overall food insecurity rate? Remember, this could be a guess. All right, and the answer is 12%, 66% voted for 12%. That's very interesting. 10% at 29, 3%, 5% agree with that, and 3% of people think that's very interesting. So what is the actual answer? 10%, about 45,000 people in our county. This is according to Feeding America, where we are about, wow, I'm still shocked about that number, 10%. So we're going to now turn it over to Daisy. Daisy, to kick us off, can you please define food security and give us a snapshot of what food insecurity looks like in our county?
Yeah, so the USDA defines food security as limited or uncertain access to enough food for all members of a household to live an active, healthy life, which a lot of the time means access to healthy foods. That's how the Foodbank really likes to define food insecurity, is not having enough access to healthy foods. But food insecurity in general has many variables that contribute to an increase, such as unemployment, poverty, income, homeownership, disability, and race and ethnicity. So as poverty and employment increases and homeownership decreases, food security increases. And in our county, food insecurity looks very different in just depending on where you're living. Different pockets of populations have different, views of what food insecurity looks like. For seniors, they might, it might look differently than a family of 5. And just in our county with COVID, it has definitely doubled. And we've seen just a really big increase in how disasters really affect food insecurity here in our county.
Wow, double, really? So Maria, you have a bird's eye view of the issue working at the county. Why should we care about food security if we have access to good food? And what are the implications of having food insecure populations in our community?
Well, hunger is a systemic issue. It affects all of us, whether we have access to healthy food or not. Daisy mentioned some of these things with food security and food insecurity, but the bottom line is that hunger is painful and expensive. Hunger hurts all of us. Researchers have linked food insecurity to chronic physical health conditions like asthma, anemia, hypertension, diabetes, mental health conditions like anxiety and depression, and for kids in particular, reduced academic performance and therefore decreased lifetime earnings. Tight budgets for food and utilities and limited access to purchase, store, and prepare fresh food can steer people towards the cheapest and most shelf-stable food oftentimes also, rather than the healthiest food, which potentially contributes to chronic health issues as well. And hunger costs all of us. In 2011, a study estimated that food insecurity cost the nation's economy $167 billion each year in direct healthcare costs due to increased illnesses, increased public education costs due to hunger's impact on child development, learning outcomes, in the workplace, lost productivity and income to businesses, and families for health-related absences, increased hospitalizations, and additional burdens and costs to charities to try and meet that need. The annual bill, if you will, for food insecurity equates to over $500 per person or over $1,400 per household. So in short, reducing food insecurity helps everyone in the community, whether you're hungry or not. By increasing food security, we improve the lives of all of us.
Wow, thank you, Maria. And I just want to make a quick reminder to our panel and back to myself that we want to make sure that we speak in a steady pace. This is a lot of information coming at all of us, and specifically our brave interpreter who's doing her best to keep step with the rest of us as we speak. So Melissa, You work very closely with students at UCSB. How is food insecurity manifesting on college campuses? And how is it unique among students?
Well, I just want to start by thinking about what a college student looks like. And so if you bring up a college student in your mind's eye, whoever that person is, they're probably the first time away from home. So maybe they don't know how to cook as well as somebody who's been on their own for a while. They probably have limited access to kitchens if they're living in the residence halls. But also the face of the college student has changed a bit over the last 10 years or so. And this year at UCSB, 40% of the incoming students, it's their first time, it's their first in their family to go to college, they're first generation students. And that's incredible that the UC is providing that pathway for them, but they probably don't have the same cushion that students historically did when they went to college. If you think about the wallet or the purse, it's probably not as padded as students have been historically. We're also seeing that students are choosing smaller meal plans. So instead of having full access to the dining halls, they're choosing 7 to 10 meals per week, which is much fewer than it has been historically. This year at UCSB, we have 430 undocumented students, and many of them also struggle with food insecurity. And we also see that 22% of students are skipping meals. And as Maria was saying, the consequences of this is dire, and one of them is lower GPAs. And so if students are not able to compete or be as successful as the other students in their class academically, then that puts them behind for the rest of their life. The other thing I want to say is that a lot of people think of students and they think of them eating ramen, and that's normal for college students, but that wouldn't be normal for any other adult. And so I want us to reframe that a little bit and think just because you're in college, it doesn't mean that you should be malnourished, because certainly the students that are at well-funded schools are not malnourished. So we want to give that same access to students across the country, regardless of their income.
Thank you, Melissa. As someone who was food insecure in the first couple of years of my college education, if I wasn't thinking about, which couch I was going to be surfing on, the other concern was how I was even going to access food in the first place if I didn't have reliable transportation, because I couldn't afford to live on campus. So you're really painting a real picture that a lot of us really understand in a tangible way. Thank you for that. Shelby, you helped launch a farmer's market in Lompoc. Amazing. What factors or barriers are in place that prompted you to launch a farmer's market? Factors that are causing food insecurity.
Well, the biggest one that we've seen, and I think why we're all here, is a big part of it is access. There is a lack of access to fresh, healthy food, and in particular, local food. So to be sure that we're being able to provide food security, we have to make sure we have a healthy food system in place. And I'm sure we all remember the empty shelves at the beginning of the shutdown, and a lack of access for everyone, secure or not. So making sure that we have that healthy food system in place, and that it's robust and supported and in clear communication with the community is extremely important. And it's still something I think we're all working on. It's also important to think of the economic side for our farmers. We have to make sure that they have access to those sales to the community so that we're supporting their livelihood. If they can't farm for us anymore, we'll be even much worse off, right? So that's a huge part of it. Within the community, there's also things that we've identified, such as just kind of misperceptions about farmers markets. I'm sure many of us have seen the shiny, happy, beautiful Instagrams of people shopping at farmers markets. That's great PR. It can feel exclusionary to a big part of our community. And we want to make sure that everyone knows that that's not the case. We want to be culturally sensitive and accessible in every language that's relevant. And those are things that need to be continued to be worked on, but things that are barriers we've identified and are working towards solving.
Thank you for that. And another one of the great gifts to bringing all of you together today is we get opportunities to bust myths. And I love the opportunity today, Shelby, to allow you to bust the myth around affordability of fresh, local food that is sourced locally. Could you please share about that?
Sure, I would be happy to. There is a definite perception that, like I said before, farmers markets are exclusive and fancy, and which can be very true in that we have quality goods. But there are also things that are being shipped the very least amount of distance, and they're coming from literally a few miles away at our market, and they're being picked fresh, usually the day before, sometimes the day of. And all of that kind of instantaneous access and lack of transportation and shipping keeps the costs quite low. When you're buying in season from a farmer down the street, odds are they have an abundance and they're happy to share it at a very reasonable cost. And at your benefit of buying something in season and as fresh as possible and as healthy as possible. So there is a definite perception that farmers markets are more expensive, and sometimes those goods might be slightly higher priced than you could see at some grocery stores. But it's important to ask why, and you can believe that the farmers will always be thrilled to tell you why and how and what went into growing those things. And it's likely that you're getting a more quality product, and it's worth that extra 50 cents or so to the pound. But yeah, all in all, they're quite comparable and sometimes extremely, even more affordable in a grocery store.
Thank you for that. So now, Casey, you work at the intersection of health and food. You have a very unique perspective on all of this. Could you share what the Sansum Diabetes Research Institute has learned about the relationship between access to fresh vegetables and health?
Thank you, Shakira. Yes, it's very interesting to hear how it's all correlated, it's all connected. And I'd like to talk about initially a little bit about what the background and what the problems are and what the Sansum Diabetes Research Institute is doing to be a part of the solution. And in the US, dietary factors have been linked to almost half of annual deaths from cardiometabolic disease. And in addition, over the past 50 years, food insecurity has replaced hunger as a major contributor to the nation's current nutritional crisis. The US Department of Agriculture spends roughly $70 billion each year to reduce food insecurity, and consumption of fruit and vegetables is well below recommended levels, with just 10% of American adults meeting recommendations of 2 to 3 cups of vegetables per day. Things have gotten only worse because of the COVID-19 pandemic. And I can tell you from some of the people I work with directly that this is the case, that many people are struggling, especially in Santa Barbara County. I learned the other day from the news that $12 billion in crops has been lost due to the pandemic. And our food choices are affected by the proximity of food outlets and the types of foods available to us. Food insecurity has also been linked to negative health outcomes, including type 2 diabetes, coronary heart disease, as you've mentioned, cancer, and and mental health problems. And in 2018, 11% of US households were food insecure sometime during the year, including 4 to 3%, which is 5.6 million households with very low food security. Now, what can we do to be part of the solution? We believe that implementing healthy food prescriptions within government healthcare programs could generate substantial health gains and be highly cost effective. What does that mean? It means incorporating agriculture with health. The Sansum Diabetes Research Institute is doing this and has launched a program called Farming for Life, which officially began in 2019. We provide medical prescriptions of produce signed by a qualified practitioner at no cost to participants, to adults with or at risk of type 2 diabetes, to improve more immediate access to fresh vegetables, because our participants collected 10 weekly prescriptions of vegetables sourced and purchased wholesale from farms within 70 miles of our location and within 72 hours of being picked up from the fields. So people are starting to understand the relationship that they have with their community and the food economy that they can incorporate themselves with, meaning involve yourself with the farms. And as Shelby said, involve yourselves with farmers markets too. Over the 3 months that participants were picking up their produce prescriptions, we saw improvements in a number of cardiovascular and glycemic metrics, including blood pressure and waist circumference and A1C. A1C being the average percentage of blood glucose, of glucose percentage in the blood. Excuse me. We also found marked improvements in things like sleep and mood and pain. We found reductions in things like tortillas and soda consumption, meaning that food security improved over the same time period, as well as people's perception on the healthy food that can be available to them. And more importantly to me is that we provided members of an underserved community with access to freshly picked vegetables during a time where people with pre-existing conditions were terrified to leave their house, even terrified to go into the grocery store, which is a safe place to get your food. So we want to show that there are different avenues and different ways to get healthy food, which means being a part of your community and nonprofits and organizations that make this access to food more available to those who need it. Because those who are insecure or food insecure aren't the only ones who can be involved. We just want to make sure that people understand the relationship they have with their own health and with their own diet.
So what I'm hearing from all of you is that food becomes in and of itself the wrap-around approach to health, wellness, and long-term vibrant living conditions in terms of their internal, mental, physical, emotional state. That's profound, that food can be literally the cure. So Maria, before we hear from you about Calfresh assistance, I wanted to poll the audience again. How many Santa Barbara County residents are eligible for Calfresh but are not receiving benefits? The poll is up on your screens. Let's take a look. All right, so we have the poll results. It looks like 40% of you say 15,000. Interesting, interesting. Yeah, very close behind 10,000, 20,000. So the answer is 20,000 people approximately, which equals about a third of potentially eligible, but are not receiving benefits in the county. So Maria, what is the county's approach to addressing these issues? And how receptive is the community to food assistance and Calfresh?
Well, as we're hearing, food insecurity is a big problem, but the county has a big solution. And that's the Calfresh program. Calfresh is here to help. It's California's version of SNAP, and that stands for the Supplemental Nutrition Assistance Program. That's a United States Department of Agriculture program, formerly known as food stamps. And it's administered here locally by my agency, the County Department of Social Services. But we do this in collaboration with county partners, or community partners rather. And two of those are on the panel with us today, and that is UCSB and the Foodbank of Santa Barbara County. And we have other great county partners as well. Our partners assist with application and outreach assistance, and they do so because they're located within the vulnerable communities. So they're established, they're trusted resources, and that connection makes all the difference. So how does Calfresh work? Eligible low-income households, they are legal U.S. residents with income at or near the federal poverty level. They receive a debit card that helps them buy more food at the supermarket or at farmers markets so that they can get enough to eat. Undocumented individuals are not eligible. The majority of recipients are children, working adults, disabled, or elderly. And the benefit amount varies on the household size and the need. And the average amount of food benefit assistance is about $118 per household member per month. And we heard what the problems with hunger or food scarcity or food insecurity was, and research has linked participation in the Calfresh program to reductions in hunger, child poverty, health problems, and improvements with high school graduation rates and better life outcomes. And I would definitely say that the community is receptive to this program. We're excited about our county partnerships with community-based organizations, and we have become more accessible to our community. Our Calfresh participation has been steadily increasing. It's increased by 40% since July of 2015. But as we've heard about the current pandemic, that's exacerbated the need for Calfresh. And so we have a sharp participation increase of over 12% just since March. So what are some statistics? In August of this year, approximately 45,000 people in 26,000 households in our county received Calfresh benefits. Of those 45,000 people, approximately 25,000 were adults and 20,000 children. And of the adults, approximately 4,000 were seniors aged 60 or older. And in that same month, where 45,000 people already received benefits, an additional 2,000 households applied for Calfresh food assistance. We talked about the costs of Calfresh, or the cost of food insecurity. And this is where Calfresh not only helps families purchase food, but it also helps our economy. So in August, for example, over $8 million in federally funded benefits were issued in our community. And what happens is these funds are spent at local grocery stores and farmers markets, and they get reinvested and respent within our community. And so it generates about $1.79 in local economic activity for every dollar spent. So those $8 million in benefits generated over $14 million in local economic activity. So that's a huge assist in our community as well. So not just food recipients, food benefit recipients, but business owners. But despite Calfresh being a big solution, gaps still exist. We've heard about the 20,000 folks that are still not enrolled in the program. So to close this gap, the Department of Social Services is trying to leverage technology to encourage online applications, online document submission, having clients sign up for text messages for key reminders. We know that Calfresh recipients have busy lives, and we're trying to make it easier and more convenient to access the program. But we also recognize that technology can be a barrier. And so we retain that traditional model of in-person assistance to meet the needs of our community. And even in this pandemic, though we've modified the way that we're providing services and we're doing remote services via telephone or online services, we have kept all of our offices open so that the most vulnerable who do not have access to telephones or computers can still walk in and be seen in our office, pick up the telephone and work with us that way. And if we need to, we will arrange a COVID-safe in-person interaction with them. But one of the things that I want to point out about Calfresh also is that it's not designed to meet the entire food problem that someone or a family might have. Food aid is generally a supplement to a household's food budget. And in 2015, the Urban Institute calculated specific percentages in different areas across the country about what that gap looks like. And in general, across the entire United States, Calfresh or SNAP benefits provides about $1.86 per meal for a recipient. And in Santa Barbara County, for the a very modest home-cooked meal that costs about $2.53. So that's a 36% gap. So even with Calfresh benefits, a person or a family will not have their entire food needs met. And so I also want to point out that sometimes people think that they've received services from Calfresh, and so that's it. They think that, you know, that someone else can benefit from other programs. But the safety net works best, I think, when we think about it like a patchwork quilt, each program being a scrap of fabric. And so when we weave those programs together or stitch them together, then the safety net is strongest. So families that are participating in Calfresh or people that are participating in Calfresh, if they also have programs like Medi-Cal or cash assistance, then they're able to have more of their basic needs be met so that they're able to focus on other things that their family needs to be safe and healthy.
Thank you for that. Wow. Great information, Maria. Shelby, you launched a farmer's market in a historically underserved community. How do you think farmers markets, or CSAs, uniquely address food security and food access in our local food system?
I really love this question, specifically for the uniquely part, because I do feel that farmers markets have a special role and are able to provide something that many other types of traditional businesses cannot. I'd like to read a little quote from a blog that was just published by the Farmers Market Coalition. It's titled Farmers Markets as Part of Disaster Resilience, which is relevant this year in particular. It's by Rachel Ward and Hannah Fuller, and they wrote, farmers markets have helped build resilience for their communities in the face of natural disasters through thoughtful adaptation, flexible structures, and the deep generosity of connected community members. Farmers markets are one place where all these food system participants can come together and build stronger relationships that create a more resilient food system. When food supply chains get cut short, the importance of a resilient local food system comes up again and again. So like we had talked before, that strengthening the food system, obviously farmers markets have a role in that, but we also have a role in our community. Having been able to stay open this whole year and be a place where community was allowed to go and connect has been overwhelmingly positive and such an honor to be able to provide to our community. And strengthening that community invites us all, I think, to continue to participate and hopefully feel welcome and feel like that access is being provided. So that's one way. Shakira, like you said, food can be the cure, and we can provide that through this kind of embrace of a community setting. We also are able to, like Maria spoke about Calfresh, we offer Calfresh at our market, and we're able to add the offer of Market Match this summer, which is an additional incentive provided. So the first $10 a customer uses their EBT incentives is doubled, and they can get an additional $10 to spend. That's funded by another USDA program. In California, we are supported by the Ecology Center, and they fund and manage that program and allow us to provide those benefits. So this summer, when we launched that program from just in 1 month, from July to August, we saw a 300% increase in those sales. And so we feel very fortunate to be able to provide that to our community. There is work to be done in North County in particular, and we're working to support getting those programs into the north of Santa Barbara County. Currently, we are the only market north of Solvang until San Luis Obispo that is able to provide those incentives. So there's work to be done. We also recognize that we can't be all of the solutions, and are working towards launching a mobile market, which would be a more accessible, open during 5-6 days a week, going to those neighborhoods where it's just not relevant or the market's not accessible to them. We are 1 day a week, 4 hours that day business, and we know that there is room to grow and people out there that we can continue to increase access for.
Yay, that is so encouraging as someone who is a food system actor. By the way, as we all say over here at the network, not only are you the network, but you are a food system actor because you eat. Shelby, I would love to include that article that you quoted in our list of resources that we will be sending out to the participants later after this webinar series. Would you mind sharing that?
I just dropped it in there.
Thank you. So Melissa, can you tell us more about how college campuses are responding to food insecurity?
Certainly. So I can definitely speak about UCSB in particular. And I'll start by just expressing my gratitude to the Department of Social Services for being a lifeline to so many students during this time, because we work closely with the DSS, and Calfresh has just been incredibly helpful for so many UCSB students and SNAP for students across the country. So just at UCSB, we estimate that over 8,000 students are eligible for Calfresh. Last year, we had just over 2,300 who applied. And if they, on average, got $180 a month times 12 months, that means that UCSB students received just over $5 million in benefits from this federal program. And that's been incredible for them. And then if they take it to that farmer's market and do a market match, then they can get even more vegetables. We have also basic needs advocates who are peer advisors. So this is another resource. It's another strategy that we have at UCSB. So we have a team of students who is available in person through the pandemic and also through Zoom and chat to listen and talk with students and connect them, help them navigate the resources and help them get matched to all these things that are available. I need to slow down and connect them to all the resources that we have. And so there's an advising center right on campus, and also now we're available remotely. We also offer prepared meals. And when I say we, I mean all of UCSB. It's not just me. Through campus dining, we've been doing meal vouchers. And there's also a swipes program where students have been historically able to donate swipes from their meal card to other students. So that way they can give them to a student who might need it. We also want to connect students with groceries. So we have 2 incredible pantries on campus. One is the AS Foodbank, and then the other one is the Miramar Pantry. And they serve slightly different student populations, but both are really well used by students and a great way for students to get resources in a familiar setting. There was also a kosher halal program. So we know a student noticed that a lot of the foods that were available through these pantries didn't meet the needs of students with food restrictions. And so there was a program launched, which is the kosher halal food program, where students can get a bag of groceries, which has been great. And there's certainly participation in that program. At UCSB, we have a financial crisis response team, and it's a really dedicated group of staff who will reply to students within 24 hours. This is for students who are facing a crisis such as eviction or a really stressful situation financially, and can help that student through our rapid rehousing program and get them into stable housing for the night or a few nights if needed, and just help them really get what they need to get back on their feet. That way they can focus again on their academics. I also love to think about the gardens. UCSB has a vibrant garden program. And so when we talk about being a food system as an eater, if you're a gardener, you can be your own food system. And some students definitely choose to participate in that. And also we are donating produce from the student farm to the AS Food Bank and Miramar Pantry. So that's a great thing. And I also want to say that UCSB has just really come together as a campus to be in service to students, and we encourage students to use these resources. So by expressing that we are a safety net for them, I think they feel more comfortable using the resources, and then they have a sense of hope, because we've definitely seen that if a student is food insecure and they feel like they are alone or hopeless, it makes their situation so much worse. And so that's why we have our dedicated staff and those peer advocates who are there for them, just to be there for them and connect them to all these resources.
Thank you, Melissa. Listening to this, I just have to give a shout out to higher education around Santa Barbara County. Whether you be Allen Hancock College, Santa Barbara City College, UCSB, I really believe that Melissa has illustrated the picture of leaving your home, whatever that looks like, being on your own, whatever that looks like, and the wraparound support, the community that higher education institutions are providing for so many of our community members. I'm moved by the work that you're all doing. I also want to mention, this doesn't stop here. There is a higher education impact group that built out of the Food Action Plan in 2016, continues to be active today, and is solidifying its relationship with the Santa Barbara County Food Action Network moving forward to be an established working group We still have work to do, folks. Daisy, the food bank has stepped up and tried to fill some of those gaps Melissa has talked about. What is the food bank's approach to short and long-term food security issues?
Yeah, so we definitely are very strategic as to where we, put our food distribution sites at, especially with the COVID-19 pandemic. We had to expand our food distribution sites, which we have around 50 sites all over Santa Barbara County. And we locate those distribution sites by, using census data, school data to identify specific areas in order to really meet the needs of the community, those who need it the most, and putting it in a location where it's close to home. They don't have to go super far. So we use that type of direct service to be able to meet the needs of all of the populations that we serve. Currently, we are setting up school district partnerships to provide ingredients rather than meals through our food boxes. Research from Feeding America shows that providing ingredients provides more choice than meals, and choice is associated with client dignity. And so we have different programs that we're able to offer. One that we launched this September was the food access to farm worker program, which we are going to the neighborhoods of those farm workers. And that just really decreases our limitations as to how to serve them, because we're going straight to them. Since our launch in September, we have been able to serve about 5,000 unduplicated individuals through that program. We have 4 locations that we go to. We're hoping to expand that more, hopefully next year if we're able to. But we rotate every month, since we do 2 locations per month, and we serve about 200 people at each distribution. And it's a great way for us to really tackle not just giving people food, but also providing education. We work with promotoras to do nutrition education, so they're able to provide that material to people in Spanish and Mixteco, and which is a big community here in North County. We also work with social services to do Calfresh outreach and application assistance. And we were able to provide resources to people about their own neighborhoods and markets across Santa Barbara County. And with seniors, we're able to have our senior brown bag program all over Santa Barbara County, where we take the food to their homes, which we had that program already before COVID, but we were definitely able to expand it completely all across all of our sites in Santa Maria, Guadalupe, Lompoc, Carpinteria, Santa Barbara, Goleta. And so with that, like, the seniors really love it, because we're going straight to them. And as we know, with the COVID pandemic, they're one of the most vulnerable populations to the virus. And so being able to provide that to seniors has really just been amazing for us. And our community programs team here at the food bank, since that's the work that we do with seniors. And it's been great for us to also implement as much as we can. We just started also providing nutrition education materials to our seniors with some fun activities for them, like a crossword puzzle. So, you know, we're trying to be as innovative as possible through all of our programs here at the food bank, and really just meet the needs, because during a tough time, we understand that you know, people need food, and you know, we're always trying to see what other ways, other than just providing food, we can help transform the health of residents in Santa Barbara County. And so with nutrition education and small fun activities, we're able to do that with our programs. So those are some of the ways that we're able to really fill in the gaps.
Well, thank you, Daisy. I love how you finish with, those are some of the ways. That is definitely what I'm hearing, is you are meeting access points wherever you find them. You're addressing the needs as they arise. And what I'm hearing from all of you, and I'm curious about Casey's take on this, in terms of access, it's a multi-pronged approach. Access financially via Calfresh, access to locally sourced produce and fruit, and access in terms of it coming to you as opposed to you having to go to it in every instance for those who cannot. And ultimately, access to that great equalizer, which is education. And in this context, gaining more learning around health, wellness, food literacy, and education. So Casey, what strategies can our community members take to ensure everyone has access to healthy food, especially the most underserved populations?
Thank you, Shakira. I would say to follow the plan of the Santa Barbara County Food Action Plan. Invest in a food economy, invest in your health and wellness, invest in your own community, and invest in your source of food, your food shed. Speaking from the work that we do with Farming for Life, we go directly to the growers to bring you the food that's freshly picked right directly to your table. We're creating a bridge between health and food security. Mainly also, as Melissa said, if you're a college student, you shouldn't be malnourished just for being a college student. Understanding what resources are available to you in the situation that you're in, whether that's with Calfresh, whether it's with the organic markets in Isla Vista or farmers markets in all counties in California. It's about understanding what resources are available in your community, whether it's through food distribution in churches. We always want to push at SDRI, understanding where you are with your own health. So speaking with your doctor, going to the clinic to understand how food can help you in the long run. And all these nonprofits are doing work for the overall goal, which I believe in, I believe we all believe, is that food is medicine. Food is a big contributor to your longevity. And yeah, please research all the organizations and nonprofits that we spoke about in this panel. If you want to take it a step further and see if the data backs up your questions, sign up with Farming for Life so we can do basic health measurements and give you 3 months of fresh vegetables to see if your health actually improves. And we have found that it does. And participating and engaging with organizations in our community, organizations like these, it helps to find a solution, especially in the times that we're going through now, where everything is up in the air. Everyone's paranoid for different reasons. Let's return to the center and understand that we have to take care of our own health, our own food, and our own families. I don't know if I answered your question.
You sure did, Casey. Thank you. So now I'm going to turn it over to the Q&A. I've got some questions from our attendees. I'm going to direct them to specific panelists, and keep in mind that if one of you has a follow-up fact bit or mythbuster or piece of information you want to make sure gets in there, by all means, put a little hand up there and I'll see you. Shelby, does your or other markets include fish, meats, beans, or other protein sources to promote access to balanced meal ingredients?
Yes, at this time, our market is not able to offer that based on a permitting situation with the health department. But as far as I understand, all of the farmers markets in Santa Barbara City and surrounding are able to provide those. And there are other, you guys have a fish market in Santa Barbara as well. So there are other smaller specific markets that are able to provide proteins and things like that.
Next question. Well, I'm going to direct this over to Maria. Maria, do we know how many undocumented head of households are ineligible for SNAP and how many children are impacted? That's a tough one.
That is a tough one. I don't have the number of undocumented households that are ineligible for SNAP, but I will say that there are households like that where the children are legally eligible for SNAP and are benefiting. So we definitely have child-only households, if you will, where the parents might be excluded or another household member might be excluded from the benefits grant.
Thank you for that, Maria. Just a reminder to our attendees, please feel free to put your questions in the Q&A box so that we can continue to make sure we're addressing those top of mind questions that you have. Now I'm going to ask a question and appeal to each of you on this. What actionable next steps, regular community members can take to support food access in our community? I'll start with Daisy. Please, can you share, Daisy?
Yeah, definitely. I think in terms of the food bank, volunteering your time is one big way that you can help support food access in the community. Like I mentioned before, we deliver to people's homes, and a lot of the time we run into finding volunteers that can do that because we don't have enough staff to be able to do that. And so if you're able to do that, that'd be great. Another one is donating food to the food bank. We will be having a Fill the Food Bank drive at both in Santa Maria and in Santa Barbara November 14th, and you can find more information about that event in at our website, foodbanksbc.org. But we'll be having it on the same day, November 14th, in Santa Barbara at our warehouse and in Santa Maria at the Trader Joe's parking lot. So donating food or money would always help us, really just being able to support food access in our community.
Thank you, Daisy. Melissa, what actionable next steps can any of us take?
I have a few. The first is to reframe your idea of what a college student looks like. The second is to invite them over for dinner. If you know a college student, or if when you were in college you got invited to dinner, you remember how wonderful it was. So if you can do that for someone, that'll make their day. And lastly, like Daisy's saying, participating in any aspect of the food system, just being involved with whatever is exciting to you will will connect you to every other part of the food system. And certainly the food bank definitely needs our support at this time of year, but all year round.
Thank you, Melissa. Before I pick on another one of you, I just want to remind everyone watching that we can also take questions in Spanish. So please, for our Spanish-speaking audience, feel free to post your questions in the Q&A. Next, Shelby, what are some actionable next steps that we can take?
My big one is shop local, shop at farmers markets if you have access to them. The more that will strengthen them and cement their place in the community and ensure that they continue to be that access point and support that they are. Consider swinging, shifting shopping habits, swinging by the market before the grocery store and seeing how much you can fill from your shopping list at what the market's available. Consider eating in season and rethinking those kinds of what's available now and how we can incorporate those into our diet more often. And all of that will support our local growers and sellers of local food.
Thanks, Shelby. Maria, what are some steps we can take?
Well, we've heard about the powerful reach of the Calfresh program, though we know it's not going to meet 100% of the food security needs of folks, but it certainly helps our partners to be able to stretch their efforts farther. So my pitch would be that if someone's listening, that if they could use help buying food, to apply for Calfresh, or if they know someone who could use help buying food, to encourage them to apply for Calfresh. And we have an online app that we're part of. It's called Get Calfresh, and it takes less than 10 minutes. And the website is www.getcalfresh.org. It is mobile friendly. We already had online applications, but they were not mobile friendly. And so that's the unique thing about this particular application is you can upload documents and manage the status of your application pretty seamlessly through the Get Calfresh app or website.
Thank you, Maria. I'm sure I can speak on behalf of the Food Action Network when I say that we will make sure that we get that app information to as many of our partners throughout the county as possible, as well as work with partners and supporting people to fill out the application and access it to begin with. Now, Casey, what are some actionable next steps?
As I've mentioned before, get involved with your community. Definitely understand where your food comes from and where the food that you want to get and eat comes from. But as Daisy has said as well, volunteering, giving your time is one of the most important things you can do for someone else. And as Maria mentioned, word of mouth. If you know someone that is struggling with these issues such as food security, let them know what resources are available. Understanding that our community is close-knit and that we do have the resources to help one another even during unforeseen times like these. Farming for Life is still operating, is still recruiting participants. If anyone is interested, go to www.sansum.org/farming-for-life or call us directly at 805-699-1519. Most importantly, visit your local farms is what I was trying to say. Fairview Gardens, Something Good Organics, John Gibbons Farms in Goleta, as well as Sunrise Organics. These are amazing partners that we've worked with, and there are many, many more in Santa Barbara. So understanding your farms and understanding the organizations that are there to help.
Thank you, Casey. And I just want to follow up with what Casey is saying. I know that one action the Food Action Network can take is making sure on our website and in all of our supplemental information that we provide information about farmers throughout the county, access to fisheries in the county along the Central Coast, and also food producers such as lamb, beef, poultry, pork. We will do our part, guys, to share that information. All right, we have several questions, and I will do my best to get through as many as we can with the time that we have left. And I want to remind our viewers that if we do not get to your question today, we will have our panelists respond to it, and we will follow up via email with responses to those questions. So here's a question I would like to address to Daisy. Daisy, what do direct service providers such as yourself and farmers markets need from institutions? I know that you talked about actionable steps. Can you speak to whether there are any regulatory or policy barriers to food access that you can think of?
Let's see. There are definitely a lot of policy barriers. I mean, funding is always scarce, and you know, we don't know, you know, whether our funding always, you know, where it's always going to come from. I know in the beginning of the pandemic, that was a big question for us. Where are we going to have the money to purchase the food to meet this need? And Feeding America has definitely been a very big contributor to that. But in terms of policy, one I can definitely think of is the pandemic EBT program, where funding for that is very limited, but it's a very great program because children affected by the pandemic, if their schools closed, they were able to apply and receive a card where their parents were able to use that card to go buy food. And depending on the state that you lived in, it could have been anywhere from $100 to $300 or more. And I know that program was extended for the months of August and September. However, there's no new applications being taken for that program right now. But in terms of our county, the reach we did was 96%, which is great. That means a lot of, I believe it was over 44,000 eligible students that were able to receive benefits. But I mean, in terms of that, that program, it just shows what the need is for families with children, and that people will take advantage of any program that they can. And, you know, we need more programs like that in order to really meet the needs of people. But in terms of just direct service, I know in terms of our partners, PPE is always hard to come by. And if you're able to donate that, great, because we use it every day. Gloves, masks, sanitizer. And as we saw in the beginning of the pandemic, it was very, very limited. And also even for food banks, it was even hard for us to purchase that for our agencies that we partner with, because you know, it was a priority issue. It was going to, you know, hospitals, people on the front lines, and food banks are second responders, not first responders. So they were going to our first responders. But yeah, that's definitely one big way, I think, for direct service.
Daisy, thank you. everyone on the panel was shaking their heads, and I'm sure our attendees are collectively shaking their heads when we all collectively agree we all need to get PPE to those of you who are serving in food insecurity and food access areas. Please, attendees, support any and all of these panelists and their partners with providing PPE, excuse me. Okay, well, I'm going to close now. I wanted to keep going, but I know we have to end and honor everyone's time. So in closing, I'd like to thank you all again for tuning in to our SBCFAN discussion series. I want to offer a special thanks to our panelists who shared their time and expertise with us today. I want to thank our funders, the Santa Barbara Foundation and the Orphala Foundation, and last but not least, the Impact Family Office that provided the sponsorship for this presentation and webinar for today. In a moment, this webinar will end and a pop-up will ask you to take our brief survey. Please share your thoughts so we know what was valuable and how we can improve. Don't forget, we'll be launching a membership program and we have our 2 more upcoming webinars. We want your insight to inform all of that. Look for a follow-up email in the next few days for a recording of this webinar and other resources. And don't forget, we have part 2 and 3 of this webinar series, 1 in November, 1 in December. There is a link to register in the chat box. So thank you so much for joining us, and we look forward to connecting with you again soon. Thank you guys. Thank you, panelists. Thank you, back-end team. You guys were amazing. Gracias, Lena.